At Skincare Physicians of Georgia, we are often asked about options to improve the appearance of a patient's face, especially as one ages. I think it's really helpful to think about what is actually happening to the face as we age in terms of actual changes to our facial anatomy. What changes are we seeing in the skeleton? What about the fat underneath the layer of the skin? While changes occur in all three, what I think may actually be the most important is what is happening to the main structure, the facial skeleton, as we age. I would like to show you some images and videos which I think will put this all into perspective. The Y-lift is one of the most amazing facial cosmetic procedures I have seen in the past 20 years. As mentioned, as we age, we see noticeable changes to the facial skeleton. First, we see overall shrinkage. There is loss of the length of the mandible, which is the lower jaw. We also see changes in the upper jaw or maxilla, including the orbit where the eyes sit. It becomes longer in the vertical dimension. This loss of bone, more specifically, is at the leading edge of the upper jaw along the orbital rim and the loss of the length of the lower jaw. This shrinkage of the upper jaw and lower jaw is the main reason for the sagging and drooping of our face and jowls. It is also important to note that we lose fat just under the skin surface, and these two combined are really what are responsible for the unflattering changes we see in both men and women. The Y-lift is an amazing procedure that addresses the basic structural losses in our face, namely the facial skeleton. By rebuilding and lifting the leading edges where we've lost bone, we are able to lift the entire face and restore what is lost, all with a natural appearance. Patients appear balanced, they look better, not different or bulky. How is the Y-lift performed? We use a blunt titanium instrument or cannula, and it is inserted into the skin beneath the muscle just on top of the bone. The muscle is then lifted by the instrument and the filler is injected to hold the muscle in its newly elevated place. We use hyaluronic acid fillers currently available, Voluma and Juvederm. Also, when patients need to restore the volume loss in the fat just below the skin surface, we use the same hyaluronic acid fillers. The key is to first restore the facial skeleton. The procedure is performed here in our office with no need for general anesthesia. There are no incisions, no cutting, and the results are immediate. You can actually think of this as a closed system facelift. One of the frequently asked questions we get is, what are the side effects and risks of the procedure? Fortunately, the Y-lift is a very safe procedure, and the reason is simple. We are placing the filler directly on top of the bone where there are no nerves or blood vessels. Of course, there is a risk of a small bruise, and swelling can also occur in a minority of patients. When swelling does occur, it is generally short-lived and gone most often in just a few days. At Skincare Physicians of Georgia, we like to say, it's your choice, choose excellence.